My name is Neil Graboy, and I am the Dean of the Milano School of International Affairs, Management, and Public Policy. And we're really delighted to have you at the New School this morning for what will surely be a very important conversation on foster teens in transition. I was actually asking before we started how many people in the room had been in foster care, and my guess was very few. Yet, this is a really important issue for us. I would like to tell you just a little something about Milano. It has a special commitment to the field of urban policy analysis and management, and it offers degree programs for master's and PhD students and classes that range from environmental policy and public finance to economic development and nonprofit management. A very large mandate. Who are our students and alumni? They're policymakers, nonprofit leaders, labor community activists, given the traditions for social justice at the New School, legislative staffers, and private sector executives. The Center for New York City Affairs at Milano, Andrew White's province, and growing every day, given his interconnections with the city and with you. But the center works in the same spirit of engagement in the urban context and is committed to promoting policy innovations that strengthen neighborhoods and improve the effectiveness of government, something we really need. Hence the importance of Child Welfare Watch, in which the center explores and supports innovation in urban policy and practice through journalistic research, focusing on solutions that make a difference in urban communities. Indeed, this event is based on the Child Welfare Watch's most recent issue, In Transition, A Better Future for Youth Leaving Foster Care. The city's been developing new programs for these populations, but given the budget shortfalls, can New York City meet the needs of teens in foster care and those who have recently left? Are young people leaving foster care better prepared for adulthood today than they were a decade ago? That's clearly a set of important questions and important issues, and the city's relationship to how one answers those questions is much like the city's relationship to the kind of social welfare that has been a characteristic of New York City and that is threatened right now, as is, we're not in Wisconsin, thank goodness. But nevertheless, we have our problems going forward. Andrew White will take us through the findings of Child Welfare Watch, and I leave you in his good hands for what I'm sure will be a very important set of conversations. Welcome to the New School. We're delighted to have you here.
Thanks, Neil. Thank you all for coming. We thought we got good crowds because there were commissioners and all that, but today we wanted people at the closer to the front line, and we have a deputy to the deputy mayor, a deputy to the commissioner, but not the not the commissioner, and yet we still have a good crowd. So it's not just about connections, is it? I'm Andrew White, and I direct the Center for New York City Affairs. I first want to thank a couple of people. The Child Welfare Watch project is made possible thanks to grants from the Ira W. DeCamp Foundation, the Child Welfare Fund, the Cyrus Fund, and the Viola W. Bernard Foundation. And our public programs are supported by the Milano Foundation. And I also want to thank the advisory board of the Child Welfare Watch, whose names are on the back page, on the outside back of the report. This morning, I'm going to talk a little bit about the report and what we wrote and the recommendations that our advisory board came up with based on our research and their own experience. And then Marianne Schretzman, who's the Family Services Coordinator for Deputy Mayor Linda Gibbs, will come up and speak, and we'll do a quick Q&A with her, and then we'll bring the panel up. And there will be, at some point, time for a bunch of questions from the audience. I'll do my best to fit as much of that in as I can. Unfortunately, Taisha Ayers, who is the young person who is going to be on the panel today, can't make it. Happily, she got a new job, started this morning. Guess I can't complain. But it does mean we don't have that essential voice on the panel, so I apologize for that. 8 years ago, we published an edition of Child Welfare Watch about teens in New York City's foster care system. We pointed out how foster care was originally designed for young, vulnerable children and babies, but it had become a system serving many, many thousands of teenagers. And that report was titled Uninvited Guests. That year, in 2002, 30% of the children in New York City foster care were at least 14 years old. Since then, the total number of children in foster care has fallen by more than a third, significantly more than a third, actually. But those in this smaller system are even more likely to be teenagers. Today, more than 35% of the city's foster kids are 14 years old or older. New York City foster care tries to provide thousands of older teens with stable homes, and many of those teenagers return to their families before they grow old enough to check themselves out of the system. But each year, more than 1,000 young people, I think last year was about 1,100 young people aged 18 to 21, leave foster care to go off on their own to try to make it in the world. And hundreds of them are parents themselves as they're leaving foster care. For much of the past decade, philanthropists and innovators and government officials, and many of you have been trying to find new strategies, been experimenting with new strategies and programs to help foster youth prepare for their transition to a stable adult life. And in the years since John Mattingly became Commissioner of Children's Services, the agency has tried to develop methods to create stronger bonds between older teens and an adult in their lives, whether it be a foster parent or a relative or a coach or a teacher, someone who can be there for them after they leave the system, who can be there to as a mentor or as a mediator or as just somebody to give them some help in the years to come. That's meant an intentional and sometimes controversial reduction in the number of foster teens living in group homes and other residential programs, because the city is trying to move more kids, including older kids, into foster boarding homes with foster families. But policy can only do so much. The real lives of older teens are the subject of this report and of our discussion today. So the policy is the context, but it's also a force that shapes people's lives, and that's really how we wanted to look at it today. This latest edition of Child Welfare Watch takes a look at the status of teens leaving foster care and those getting ready to leave. We focused especially close up on the experiences of young mothers, though not exclusively, and on the issues of housing stability for young adults after they leave the foster care system. We found a lot that's interesting and positive that's happened over the last few years, but we also found that the overall situation remains very troubling and unfortunately a lot like it was 10 years ago. Well, 8 years ago when we did the last report. It's interesting to note that the number of older teens in the foster care system, in particular those over age 18, which are the darkest blue there, remains relatively flat. So you see that the number of younger kids has declined sharply, and the number of middle teen years has shrunken somewhat over the decade. But the number of kids 18 and up remains pretty much the same. Year after year, there are about 2,500 young people aged 18 and older in foster care. Some of them are finishing high school, some of them are going to college, and others have gotten a decent job. And staying in care is actually a good way to remain in a good place while you're doing that. But the reality is that most are in a much more precarious situation. There's plenty of evidence that extreme poverty is a very real part of life for many young adults and older teens leaving care. About 15% of young people leaving foster care have been ending up in homeless shelters within 2 years. Half of that 15% are young moms entering shelters with children of their own, according to an internal city review. And this is especially important in the larger context of housing instability for young people. The total number of 18 to 29-year-olds using the city's homeless shelters has increased sharply over the last decade. That's that chart. It's gone up to more than 32,000 in 2009, We don't have numbers yet for 2010. Only a fraction of these young people have been in foster care, but it's not a small fraction. So there's clearly something much larger than foster care happening. And maybe it's no surprise to you, housing is not all that affordable. But at the same time as this is happening, many of the long-standing tools for housing assistance are becoming inaccessible or non-existent. Federal Section 8 rental vouchers are no longer available. And last month, Governor Cuomo proposed eliminating $35 million in state funding for the city's Advantage two-year rent subsidy program, some of which was going to kids leaving the foster care system. Public housing is an option for some young parents, but not always the best. So here's one theme for today's discussion. If meaningful government rent subsidies are now entirely unlikely for most young adults leaving foster care, then what's a realistic alternative to ensure that they'll have a place to live? We know from other very solid research that a majority of young people aging out of foster care have low rates of employment and very low incomes. After leaving foster care, most will go back to live with their family or with relatives for some period of time, even if that family is no longer legally connected to them because of a termination of parental rights. Which raises more points for discussion. Living with a parent in these circumstances can be sometimes volatile, but is there some way to make sure these families can get help even if they have had a TPR and the child has grown up in foster care and is now coming home? Is there some way to make sure that their stress and their own economic or other difficulties don't make it impossible to take in their child as a young man or woman? Is there some way we can help to mediate problems as they arise, whether they're over boyfriends or jobs or the cost of food and utilities? In our report, we looked at an impressive experiment in supported housing for 400 young adults, half of whom are coming out of the foster care system. It was funded through the New York 3 agreement, and there's a tremendous article in there by Kendra Hurley about the lessons from that project and what it takes to provide housing for teens 18 to 12, they're not all teens, teens and young adults who are not necessarily going to succeed at everything they try. Increasingly, researchers of brain development and human behavior consider the late teens and early 20s to be a transitional period between adolescence and adulthood. So independence is a valuable goal, but it's not always a reality. The organizations running these supported housing programs are finding that they need to let young adults learn from their own mistakes, sometimes fairly major mistakes, without too quickly imposing an eviction or other harsh sanctions. But sometimes those sanctions become necessary. The question is, at what point do you do that? There are other examples of inventive and effective programs and practices that are talked about in our report, and there have indeed been some positive changes in recent years, but there are no simple solutions to the hazards of adolescence. One of the surest ways to become and remain poor is to be a young single mother. In New York, about 2/3 of all families with children living in poverty are headed by a single mother. And each year, several hundred young women and men are becoming parents while they're in foster care. So in the report, we wrote about the hurdles that young mothers face in housing and education, the job markets, and elsewhere. Much of that section was written by Abigail Kramer. And we pointed to opportunities for improvements in policy and programs, many of which we'll talk about today. And that brings me to a couple of important points before we go on to the discussion. Ultimately, the best way to prevent young people from aging out of foster care is to not place them there in the first place. But the city's foster care prevention and family support programs are in trouble. It appears anyway from all of our reporting that administrative errors in handling contract bids combined with threatened budget cuts last year led to a very sharp reduction in programs and staff at nonprofit agencies providing preventive services. And these are all kinds of services, but primarily case management services that help people deal with crises before they reach the point of having to take a kid out and put them in foster care. As a result, beginning last spring, as these programs ramped down, expecting cuts, trying to figure out their contracts, families became a lot less likely to find services. And then when the city council restored funding in June, nonprofit agency executives we're not too eager to ramp up the programs again without the clarity of their contract and without the clarity of ongoing funding past this year. So now we have a preventive system that's far below even its funded capacity, which is kind of a stunning situation given our current budget crisis. There are services that can help families with young kids, but these are also services that could help young families themselves, young moms with kids, and these are services that can help parents preparing to welcome home a teenager from foster care, potentially. So if you look at this chart, as of September 2010, just 11,553 families were taking part in city-funded preventive programs. These are the ACS-funded programs, down 19% from the same month in 2009, and nearly 30% from September 2008. This chart is the July numbers and then September. So that's 2 years of decline right there. The sharpest drop started last spring. Similarly, the total number of children in preventive programs is down 23% since a year ago to 23,000. So what should we do? On the back cover of the report, as I said before, are the names of the Child Welfare Watch Advisory Board. They're at the core of this program. Of this project. They don't have any editorial say over the bulk of the report, but they do have a voice and take leadership in developing the recommendations that appear starting on page 3. And that can be a tough process trying to get everybody on the same page, but in general, we have accomplished that every time around. It'd be great if you would just take a look at those. Here's a handful of them, of the core recommendations right here. More resources for strengthening families. In other words, using preventive and other services, like preventive services, to work with families, including families that have possibly had a termination of parental rights, but to whom older children are likely to come home. Another recommendation was hire young people as peer advocates. The city has done a bit of this, and some of the agencies have done this on a small scale. It's, I think, pretty widely recognized that peers, kids who are in foster care or who have been in foster care, are a huge resource for those now leaving the system. Enforceable standards for ensuring that young people are connected to meaningful assistance after leaving foster care. And this is core to the city's agenda. The question is how to make it more real than it is today. Comprehensive sex education and family planning. We'll talk about that on the panel. Stable housing for young mothers before and after they have their children. And school attendance and graduation should be at the top of the priority list for teens in foster care, including teen parents. Too often, they're pushed into GED programs or not encouraged to stay in school or not given what they need to stay in school. So that's our report. I hope you'll take the time to read the articles if you haven't already. I want to introduce our panel. First, I'm going to introduce Marianne Stretzman. Marianne is, unfortunately, our label there is wrong, but sorry about that. It says Department of Health and Human Services, which doesn't exist, I'm afraid. Marianne is the Family Services Coordinator for the City of New York. She works in Linda Gibbs' office, where she's a deputy, and she is responsible for trying to find ways to coordinate across all of the city's various health and human services agencies to work together on key issues. So, Marianne, you want to come up and say a few words, and then... You're welcome.
I really want to thank Andrew and his group and everyone here. My name is Marianne Stretzman. I'm the New York City's Family Service Coordinator. I haven't seen some of you in a very long time, those that I know and have worked with before, so it's really great to see the commitment that you continue in this field and continue the advocacy that you've been doing. So I thought that it would be helpful to talk about a little bit about what we're doing in our office and what the office does. We work for Deputy Mayor Linda Gibbs, and we basically coordinate the 7 human service agencies together. We have oversight and a coordination function, which means that we're very data-driven, and we look at data and we determine, hey, is this working? Is this not working? Is this a problem? Is this not a problem? what are the best practices and how can we lift those practices. So I want to just run through with you a little bit of how it works. And what I would say my talk for 2 minutes here is about planning and coordination. And for me, coordination comes first and then we plan. And we are at a great point in our city's history in terms of coordinating, because we have data that we've never had before. I worked at ACS and DHS for many years dealing with these similar issues. And I could never tell who were the kids who were going to school, who were the kids who weren't going to school. And when we were trying to put in initiatives, we didn't have the data to tell us what was going on. So I want to talk to you about at least 2 initiatives that are going on today that would not have gone on in the past because we didn't even have the data to know. And the data has given us the ability to put in place educational directives, if you will, in our homeless shelters and at the Administration for Children's Services foster care agencies. We have piloted 15 shelters where we have foster care children and other children who are in our schools. And we looked at their attendance rates, and we're looking at their grades. And it has been given us the ability to put in programs at the shelters that give these moms and fathers and children a way to use educational resources that are helpful. We have a homework center in each of these shelters. We have computers, and we have telephones to call the help hotline. So the biggest piece that we're bringing in our office, if you will, is that we're looking around the city, and we say, what is going on that's innovative? And how can we get our people in those programs? And that our people are the people in foster care, the young people, the children, and as well as the homeless services. And so we've been very diligent. We've done this with DYCD as well, with the Youth Employment Program, which, as you know, is on the chopping block, which is a critically important program. We have to get that restored. And we assure that the kids who are most vulnerable are getting those jobs. Jeannie Mulgrave has been a terrific supporter of helping us to do some of this, as well as the folks at DOE, DHS, HRA, and ACS. So we have meetings on a bi-weekly, bi-monthly, every other week, to go over what's happening with the kids and where are they, and what's their attendance, and what school it is they're going to, and what it is that we can be doing. So I'm glad to say that this is what's happening at City Hall. And I'm glad to say that we're able to make a difference in working with you in the provider world and with our counterparts in agencies that have a big impact on our kids. So this year, 2 pieces just on education came out. One is we had a Saturday where we had all kids from foster care who are in 8th grade, 7th and 8th grade, come. We hooked them up with school counselors as well as volunteers to make sure that they filled out their high school applications. Think, well, that seems simple. It's not simple. Filling out high school applications and matching needs of a child, of a young person with the particular high school is a big deal. So that is something that we've put in place, and we will continue to do that on an annual basis so that every young person in foster care is hooked up appropriately at the right time to get into high school. And we've also been working closely with multiple pathways at the Department of Education. These are programs that are really suited for some of our children, young people, which are programs for overaged, undercredited youth. And as you know, among that group, the graduation rates are something like 12%. They're really dismal. And through multiple pathways, we've been able to identify youth in foster care, homeless services, who are overaged in terms of not having enough credits, and placing them in these programs. The graduation rates just have been the median graduation rate of one of the transfer schools in the multiple pathway system has been 52%. The young adult borough centers has been 61%. The Learning to Work program, where they're going to school and getting skills, 15,000 students have graduated. So these are programs that do not get spoken about often in terms of foster care and homeless children and children transitioning from foster care. But these are the exact programs that young people could really benefit from. So the office is trying to make those matches constantly. We're the advocates, if you will, inside the bureaucracy. And we make sure, and somebody said to me, geez, Marianne, you know, every time I talk to you, it's like you're the kind of person that, it's like, all you talk about is rice and China. Like, and they were making this analogy that I'm always talking about the same thing all the time. But the fact is that homeless youth, foster care youth, need these services. And if we direct these services to what's going on in our city, they will benefit. And so that's an example around education and to streamline that and to support that. The example that I was thinking too is around housing. And for those who know, my experiences come out of homeless services and understanding at that time we really wanted to end homeless, and we still do. And there's still hope despite budget cuts and various challenges that are happening today. But when we were at Homeless Services, we were looking at who comes into the system. And at that time, we saw that young people aging out of foster care were a group that were coming into the homeless system. And we were like, this is terrible. So we kept putting pressures back, and we started tracking those numbers, putting some pressures back. And that has made a difference. And one of the differences that it's made is that whenever the city now talks about housing, it's no longer just about homeless kids. It's also about youth in foster care. Whenever we talk about rental assistance and subsidies, yes, they're on the chopping block, and yes, we've got to do a lot more advocacy, and youth in foster care are included. When we were talking about New York 3, the supportive housing, that's who we included. We expanded those definitions to include so that this group is a part of that housing solution. So I just want to impart to you of how much the city, in this coordinated process under Deputy Mayor Gibbs, is now able, probably in many ways because of the new technologies and for the first time, to address issues that were in the silos. And I'm not saying we're not still in silos. We're pushing, we're pushing those boundaries all the time. But we are also using the data to help us to get outside the silos so that we can target resources to some of these young people who really need the resource. And so that is something that we've been up to, and that has been really the strategy, if you will, to lift what the city has to provide and ensure in this great, compassionate, generous city that these young people are getting involved and having the support to get those services. So that's where we are in the office. And just one last thought well, I won't repeat myself. So I'm here this morning. I am glad to answer any questions that you have. And if I do not have the actual data or the numbers, I'm glad to come back, give to Andrew, and we'll have a dialogue. It's really important we stand up for this population of young people, that we make sure that those resources that are out there, that they're getting the first shots at them, and that people know what's going on so that the young people can get involved. I truly believe that isolation is what's the killer for all of us, and it's in that isolation that we are as sick as we can become. Isolation is not a good thing. We have to think of models and continue to build the models we're building to reduce isolation for these young people so that people have connections and are making connections to adults, to peers who will strengthen them. These are the kinds of things that we need to do as a city and allow our agencies to be able to support the collaborative process. And so I really do believe that the office has pushed the agencies to be more collaborative. We've used the data to advocate among ourselves, to demonstrate problems and what we're going to do about it, and created initiatives from, you might know about CEO, the Office on the Center of Economic Opportunity. Just a small program there, CUNY ASAP, we have some young people in foster care going to community college. They get wraparound services to go to the community college. Community college, I didn't know this, being a community college graduate myself, that only 12% of kids, young people go to community college, adults as well, graduate in 2 years. Our rate with the CUNY ASAP has been 30% in 3 years. So these programs are working. When we know what works in terms of when we're able to wrap around services and give support, young people can remain in school, get educated, get a skill, and get work. So I think in a lot of ways we know what we need to be doing, and we need to continue on that path. So thanks for giving me the opportunity. I'm here. I'll talk more about what it is we're doing and where we're going.
So a couple of questions for you before we bring up the panel. I mean, one is this question around data that you brought up. And you worked in homeless services, you worked at ACS. How do we figure out who is most at risk of leaving foster care and ending up in the shelter system? Do we have some idea about that now? And how do you orient services across agencies to deal with that?
We have some idea because we have a history of who ends up homeless. But what we don't have, and we could look at the kids who end up homeless and who they were. We could look to see what kind of goal. Are they the ALIP, the Independent Living for APA goal? Do they have the goal of APWA? Or do they have another goal where they were reunified and came back? And so we're able to distinguish that. But what we are not able to distinguish are who are the kids who leave foster care and do not come into the system? And are there differences between those young people and the kids that do use the system? And that will lead us to a risk model, if you will, to be able to know who's more at risk than one young person from another. Because one young person isn't as risk just because they're in foster care as others. There are risk levels, you all know that, working, and how do we do this is something that we're very interested in doing.
And we had sort of, it was a common trope for many years that the reason there was an opinion in government that the reason a lot of people were going into shelter was to get hold of Section 8. I mean, now that we know that Section 8's not an option, I mean, there's still work advantage, or what's left of it, but to what degree is it an incentive? Is there an incentive potentially, or even a perceived incentive for young people, even young moms with their own kid who maybe aren't feeling so great in their foster care situation, to go into a shelter in the hopes that that will lead to something better? Is that real or not?
I'm not sure if any of that is real. I mean, I think when people are homeless, they're in great need. And I'm not sure when you're living in a crisis situation that you're really thinking, if I go here, I can get over and get some voucher, or I can, do this. I think people, unfortunately, planning is a daily process instead of perhaps like, maybe I can get to school and get to work and a skill. So I'm not sure that's the motivation all the time of people coming into homeless services. I think that there are complicated reasons why somebody ends up at the door of the homeless shelters, and it's not necessarily motivated by vouchers. With the Section 8 issue, that was that the spigot comes on and off, and the city in the planning process did not want to rely on Section 8. And that was the reason why we thought to put Section 8 in the communities to prevent homeless in the home-based communities, not to keep it in the shelter, because in the shelter, it increased length of stay because it took so long to get a Section 8, that if we could stabilize you in the community, give you the Section 8 in the community, we thought that would prevent homeless. And that was the policy issue. We created our own local rental assistance program, which is in jeopardy today because, as you mentioned, it's on the chopping block, and we need to do more advocacy to get that back.
Right. And the last question is, what can be done to resolve what's happening with preventive services? Do you all have some sense of next steps?
Well, I think we've hired a great person who will be the Deputy Commissioner of Prevention Services, Charles Barrio, and he comes from Good Shepherd Services, and I think coming from a provider group to government brings a certain sensibility, and I have great confidence that he'll be able to move the system and have it so that prevention will be back up and running and continue to do the good work that it's doing.
All right. So we'll talk a little bit more about that with the whole panel. Why don't the rest of you come on up and I'll introduce everybody. Thank you, Mary Ann. Somehow we managed to put government at opposite ends of the table here.
That's good. We won't pass notes. The problem is they give me notes, they approve notes, and then I don't read the notes.
At the far end of the table is Lorraine Stevens. She's Deputy Commissioner for Family Permanency Services at ACS, which essentially means Deputy Commissioner for Foster Care at ACS. She's been in this field for about 20 years and has both management and clinical frontline experience. So that'll come in handy in this discussion, I think. Next to her is Linda LaSalle Bryant, who's Executive Director of Inwood House. She's a member of the Child Welfare Watch Advisory Board. And she works primarily with pregnant and parenting teens. Next to her is Teresa Nolan, who is program director for one of the programs at Green Chimneys, or division director, I should say, and she oversees LGBT services for youth in foster care at Green Chimneys. Green Chimneys is especially known for one of their programs here, which is a congregate program for LGBT youth, but also counseling and other supports. We have an addition to our panel. Thank you for stepping in. Taisha Ayers couldn't make it at the last minute, as I said before. Danya Dunkley is a nurse home visitor at the Nurse Family Partnership Program, the targeted citywide initiative for children for young moms in foster care. And she'll talk a little bit about how that program works. There's a profile of it in our report. And Priti Kataria is director of the Adolescents Confronting Transition Project at Lawyers for Children, which is a law guardian program, the lawyers that represent young people in foster care. So there's a lot to talk about and nowhere near enough time to do it, but I want to make sure that we get quickly into this question of housing. And and I'll start with Lorraine, if we have to assume that there's pretty steep limits on subsidies. I mean, long-term subsidies just are basically non-existent at this point. Short-term subsidies are, in question. What can be done? What's the alternative to that for young people leaving care? What are some of the barriers that have to be worked out for this system to come up with a meaningful way to make sure young people have a place to live when they leave foster care?
I would definitely say that housing for young people leaving foster care has definitely been a challenge for us, and I probably don't need to speak to the choir here today. We were encouraged with New York 3 that started 2 years ago and have been able to place about 200 young people in a supportive housing situation, and have some agencies here today who run extremely wonderful supportive housing models for young people that leave care up until the age of 25. But just to take us a little bit, couple of steps back, housing is definitely an extremely important resource for young people aging out. But the discussion or the conversation in this environment today of limited resources really needs to change. And I say that because as we all have been struggling with the reduction of the vouchers, with Section 8 not being available, with the limited number of supportive housing resources, how do we look at what is available, but also how do we help our young people connect to resources that are going to support them way past that supportive housing model? And that's been a challenge of the child welfare community. And we've been talking a lot with our providers about how do we do that? How do we do that family finding work, not at the age of 20 when they're getting ready to leave the system, but earlier in the process? How do we talk with them about they deserve a family and that it's important for them to be connected to someone after they leave? And this is challenging work, and it's challenging work for caseworkers with high caseloads and staff at the agencies, and we recognize that. But I wonder how we as a child welfare advocacy community can start to change that conversation and put the resources up front in finding those families and making sure that, yes, housing is important for some people. Not everybody goes to a family, but that we really target our work on finding those right families for those young people.
Is there some way then? I mean, one of the questions becomes, okay, you find a great family, how you find a foster family or the parents of a child who at age 18, 19, 20, 21 could potentially be a resource, but once they're past 21, there's no more foster care money if they're still at the foster parent, living with the foster parent. If they go back home, there's no resources for that parent. Is there some way that the system can be changed, that some regulations or something can be changed so that some resources can flow to help pay, instead of a voucher, but can help pay rent or pay for food, pay for utilities when they live with that family?
So I'm not sure if I have the answer to that question in terms of what regulations and so forth can be changed. I do know that with our providers, we have constant conversation about the need for aftercare support for families. And I think you mentioned that in your report in terms of the availability for preventive services for those families and those children returning back to families, or their own identified resource is preventive services available resource. So I think the conversation is happening. I agree with you. I think we need to look closely at what is available statewide, citywide around aftercare support, and what does that mean for our families.
Okay. Teresa, I know you've had some concerns about this approach to focusing on moving older kids out of congregate, or not even placing them in congregate in the first place, in congregate programs like group homes and so on. What are the issues with that, and sort of how do we move to the next phase of that debate?
That's a great question. You know, I think a lot of times, you know, we're thinking, when we work in the foster care world, we're immersed in a certain population of young people. And, you know, when you think about, you know, I think the number was 1,100 older youth in care or discharged as they aged out. And if you think about the general population, 1,100 doesn't sound like a lot of kids to be worried about. But it is a lot of kids to be worried about, because when we break it down, we're looking at these are the young people that are going to continue on to be to need a lot of services in other areas of our city and of our government. So if you think about the ability to provide more complex levels of services within either a homeless youth program or a foster care program in a group facility, that folding in a lot of those other services are going to keep them from needing the services later on. So, one issue that I think comes up for me a lot around placing youth into family settings, and it's quite ironic, I have to tell you, I did a training 3 times this week already on homeless youth and reaching out to families. I think in the homeless youth world, people are much more afraid of connecting with the family because the kid's already been kicked out of home. And in the foster youth world, we're very obsessed with family, right? It's 2 very different types of approaches. So I'm very much a believer in connecting young people with families when possible and when appropriate. I also think that with a very specific niche of the population, it's not very realistic all the time, unfortunately. We're talking about understandably, I'm talking about a very small group of people that are very, very much underserved. Youth that are already in care when they're 18 to 21, right? That's already one set of it. Youth that, of that 18 to 21-year-old group, they probably have mental health issues, maybe burgeoning addiction issues, maybe have had involvement with the criminal justice system already. And specifically at Green Chimneys, of course, we look at the LGBTQ youth population, which is even smaller. All of those types of issues rolled in together makes finding a family, obviously, extremely difficult. So I think when we when resources are limited, obviously, we need to cut out things when we can. But what we're talking about is really putting an extremely vulnerable set of young people into even more vulnerable situations. I can't tell you the number of times on our homeless youth program side that we've had young people that were adopted or had been placed with a foster family, had discharged from care, and are now homeless. That there's not a long-term planning process sometimes for some of these young people, as was mentioned earlier. So it makes, although it might look good, they were adopted or they went to a foster home, but there's not long-term support. We know these are really vulnerable young people that are high risk when they're 22, 23, 24.
So, if housing subsidies are so scarce, is this sort of what can be done? What's the alternative to housing subsidies or to these supports? Is support services an alternative to make, if they're not going to connect with families and they're going to come out of a group home? I mean, I'm sort of backing into this question, but my point is, if you don't connect them with a family, then how do you provide long-term help?
So I think I want to specify that there's a difference between connecting to a family and living with a family. I think they're 2 very different concepts, right? I think a lot of us probably, when we were young adults, would never wanted to live with our family if we had a choice, but we knew when it came down to it, our family would take us in. We wouldn't be out on the street, right? But there's a difference when you have a choice around that. And I think permanent connections are key. I think Lorraine talked about, I think that is an area we need to continue to focus heavily on. In terms, I think, a lot of programs try to do mentoring, and that's not, we don't get paid to do those kinds of services. Our mentoring program, for example, we seek a private grant to do that because we think it's important. But I think there are alternative and more creative ways we can find those connections too. Mentoring doesn't have to just be, the traditional idea. I think career mentoring is a really important thing, connecting young people to successful professionals that they wouldn't necessarily meet, looking at ways to help enrich a young person's life. It may not directly answer the housing question, but in the long term, with all of those services wrapped around, I think it does. And I have to say, I'm a huge fan of New York 3. I think that it's a great resource, and we have a lot of young people that are able to access it before they're 21 and have that safety net with us as they're moving out into that resource as well.
Pretty, you represent young people in foster care and getting ready to leave foster care. What do you see as the greatest barriers in the current situation?
Could we schedule a new symposium?
Sure.
I'd like to just take a whole day. The biggest, you know what? I have to say, if I had to sum it up in a word, I'm going to go with you, Marianne. Planning. Planning.
Close to the mic. If you
Sorry, let me close my eyes. Planning is really the #1 thing that I would say if we could start anything, and this is around housing, it's around education, it's around connecting young people to permanent, resources. It all takes planning because a lot of times the statistics you even gave us show you exactly the disparity because we're talking about a population that you're talking about independent living, being on your own from 14 on, but the discussions about what it takes to get housing, what it takes to get a job, what it takes to actually transition out of foster care successfully, those real concrete conversations aren't happening until they're already 17, 18, and by that point you have a young person who, now let me backtrack and give you a little background on my specific expertise. I came onto staff at Lawyers for Children in the beginning of 2006 when the state legislation was just changed to allow court review of cases of young adults between 18 and 21. Before that, even though there are regulations, even though they could have remained in foster care, even though they obviously did from the data we were seeing, in terms of actual court oversight, that was a missing piece. So in 2006, the Robin Hood Foundation and Lawyers for Children decided this was a population that needed real intense work right off the bat. So we started the Adolescents Confronting Transition Project. We're now the highest funded and the highest staffed special project within the office at Lawyers for Children. And one of the things that we try and do, it's fun, like all of the recommendations, I'm looking and I'm going, ooh, we did good. Like we're checking off. We have a peer advocate. We have a youth advocate. His name is Joel Melendez. He was youth in foster care. His expertise in being able to make that connection and have that conversation earlier can save a lot of these situations where you have a young person who's already shut off from everyone else. The caseworker is just, I say to everyone that I spent maybe the first week to month of a new client unpacking the y'all. Because it's, y'all don't do anything, y'all don't care, y'all aren't gonna, y'all don't, I'm not y'all. I work for you. Let's talk about what needs to happen. And unfortunately, like Lorraine was saying, the caseloads, the resources, you don't necessarily, if we're talking about utopia, I would love to have at 14, like just a little mini workshop at that point. Like if you're gonna have an independent living goal, let's sit down and talk about, okay, you're 14 now. I'm not saying you have to go and fill out these applications, but let's talk about what it looks like to grow up, because that's one thing that they're not getting. If you're a young person entering the foster care system, they don't necessarily have that. If they're lucky, they have someone who will sit down and say like, okay, so when you fill out a job application, maybe you shouldn't put the one where, you know, you went for 2 days and then you decided you didn't really like it. Like, maybe let's talk about an internship that you did like and you really connected to, and how can we parlay that? There's not necessarily that attention paid when it can still penetrate. Right. Because the longer you linger in the system, the more, and I hate to say this, Mary, there are some of my young mothers who will just say, you know what, I am sick of this group home. I think going into the shelter, at least I'll get a tier 2.
Yeah, I don't want to be I don't want to be naive that people, one of the reasons why they may come to the homeless shelter, especially young people, is to emancipate from parents. And that's not only a foster care issue, that's often with young people, with children. And certainly, I just don't want that to be said that that's why the city is cutting Section 8. The city, the reason was to put Section 8 in the communities and to have our own rental assistance program so that we can help people move out of the shelter faster. And that was the paradigm change. So that was, but yes, emancipating into the shelter is not a great thing. And in some cases, parents are actually doing a decent job, and their young person with their child is acting out and they're leaving because the parent can't control that child, and they come to the shelter. And for us to say yes in that circumstances, we become enablers for bad behavior, frankly. So that's something that with eligibility we take into consideration. We go out there, talk to the parent, try to get resources for them so that they can work with their daughter, their young daughter with a child. These are the kinds of family situations that do break down, that do lead to homelessness.
So, you know, a lot of what we're hearing about is sort of these things that are fundamentally what a parent needs to do with a teenager, right? Mm-hmm. I mean, that's no surprise. But the question then becomes, is this about policy or is this just about practice? Are we not providing resources for the foster care agencies so that their foster parents are doing what's needed, or the group home staff isn't doing what's needed? Or so is it a matter of resources? Is it a matter of simply needing better coaching, training, frontline services? I mean, this is a huge, complex problem, right? But the reality is we all know how difficult it is to raise teenagers to become adults. At the same time, we all take responsibility for our own kids. How much of this is policy versus practice? Linda, you want to take a stab at that?
All right, I definitely think it's both. I think from a practice perspective, one of the things that we are inconsistent with is keeping in mind a developmental framework. If we were talking now about kindergartners or preschoolers transitioning into regular school, it would be very obvious to all of us that there's a developmental leap that's going to be made here, and there's certain supports that are needed to help that child make a developmental leap. But we forget that teenagers and emerging adults, we're talking about development as well, and that it's a process, and there are certain supports that are needed. So in terms of practice, we need to be much more sensitive to that. In terms of policy, where we're lacking is the recognition that we will pay for this one way or the other. It's just a matter of choosing where we want to put the resources. So the kid we don't develop supports for now, we will pay for in the shelters, at the DHS door, in public assistance. So if we were to actually track that and look at some of those resources that go to help that young person in those systems, maybe we could think about a way to funnel some of that to fill in some of the gaps in the current system. Going back to development a little bit, if we look at the SILP model, wasn't a perfect model. I'm sure there were reasons why including resources, why it's not here today. But at least the one thing about that particular approach was it did take into account development in that it assumed young people will need to practice the skills of living like an adult. But they'll need support and supervision in doing that. We now have a system that doesn't have those sufficient numbers of those opportunities to practice under structured supervision and guidance, so that if you make a mistake or you fall, there is support to get back up, because that's the nature of development. So I think it's both practice and policy, and it really requires a radical look at where we are distributing our resources, because we do pay. So when we say we don't have it in this bucket, but we are paying for it in another bucket. And that's a choice we can make.
Good answer.
Danya Dunkley, thank you for stepping in at the last minute. Some of what Nurse Family Partnership, for those of you who don't know, has this home visiting model and sort of close mentoring work with young mothers. That they have now sort of honed in and focused on kids in foster care and in the homeless shelters. And I shouldn't even say kids, I mean young moms in foster care and the homeless shelters. And also at Rikers,
Yes.
right? So to what degree is sort of what you're doing really common sense, and to what degree is it systematized? So tell people a little bit about your work, your daily work, but also some of the parameters, why it seems so especially effective for the people who are able to make it into the program.
Nurse Family Partnership is basically a program for first-time moms who are low income. It is a national program, so it's not just localized to New York. Basically, each client has a nurse who visits them on a weekly to biweekly basis, and we center on parenting, teaching them what a healthy pregnancy looks like, how to take care of an infant, and also we do some promotion on self-sufficiency. So basically, we're trying to improve. Promote self-sufficiency so that when they do become parents, they learn how to be more independent, and because most of them are, minors, so they can be more productive citizens.
What's your day-to-day work like?
Okay, we make home visits basically wherever the client would like. Most of the time we're visiting either foster homes or maternity residences, homeless shelters, and yes, we do make visits to Rikers as well, to the pregnant population there.
And you start a couple of months before, how
Yes,
far before they
have
have it?
in order to enroll in the program, they must be below 28 weeks. So we do see them for the majority of the pregnancy until, I'm sorry, I missed that piece. The child is 2 years old.
Until the child's 2 years
That's when
old,
the program
right.
ends.
So it's long-term, and you're meeting every week, every couple of weeks?
Yes, it goes back and forth.
Right.
There's a structure. Initially, we meet every week for 6 weeks. Then it's biweekly until the baby's born, back to every week postpartum, and then every other week. And then it tapers off around 2 years old to about once a month.
And what is it about this work that, I mean, some of it is just teaching a young person about development, the child's development and what to expect and all that, but then there's a lot of planning and so on that goes into the life of the mom too, right?
Yes, we do focus in on the parenting and the clinical side, but a lot of it, like I said, is to try to promote more sufficiency, especially economic self-sufficiency, because we do encounter a lot of problems, as we've been discussing with housing. And even the moms that do get placed into their own apartments, they're not well prepared. There is a breakdown with the planning, especially with the foster kids. They don't know anything about budgeting, so they get out there and they get into, they fall into lots of traps. And it's a burden because here, they're already young, and then you compound that with being a parent. They don't know how to raise themselves, but they're trying to raise, a child. Aisha is actually my client, and I met her when she was pregnant at New York Foundling, which is a maternity residence and also a foster care agency. And she went from there into one of the SILP independent living programs, and then from there into her own apartment now in Brooklyn. So she was, very fortunate to have a good plan in place, and she herself was very proactive. Of course, there were people behind her like myself and others involved that were helping her along the process. But I think for maybe clients that don't have the motivation that she had, they slip through the cracks a lot of the times.
How did she afford her own apartment, do you know? Or kids like her, how do they afford their own apartment?
Well, she does have a job. So
Two at last count.
Yeah, which is why she couldn't be here today. She did get herself a part-time job, but a lot of her rent is subsidized, by ACS and the city. So she's able to, live comfortably with.
So what happens after the 2 years are up?
Yeah, that's hard. We have to disenroll the clients at 2 years old. That's just how the model works. But we do try to seek out other programs that might be able to help from 2 years old on, like a Head Start, Healthy Start program or something like that. But
right. And actually, Linda, either one of you could answer this. Taisha, when I spoke with her a couple of days ago, she was telling me about a friend of hers who spent most of her pregnancy just lying on the couch at her foster parents' home because she didn't qualify for the program or didn't get into the program. I mean, there are pretty strict parameters about who can get into nurse-family partnership programs. So what can be done for those who either don't qualify or don't come early enough to NFP so that they don't spend all those months not planning, not going to school, et cetera?
I'm not sure if the parameters are strict. We don't ask for proof of income. Targeted Citywide Initiative is focused on the foster care population, the homeless, and the incarcerated. But Nurse Family Partnership on the whole, it's just low income, first-time pregnancy. So, and we don't ask for any proof or anything like that. You don't have to show us a W-2 or anything. So it's completely voluntary. And believe it or not, it's free of cost. Sometimes we have a problem with, getting youth to stay in the program. So a lot of times, some spots are filled and the teens, they fall off the wagon, and then there are others that are waiting. I think we just have more clients than nurses.
Right.
So that's a problem too.
So resources. Yeah. Linda, what is one of the answers here to just invest heavily in that model and broaden it out, or do that plus other things, or what?
think we need to invest in a variety of approaches and models with the recognition that a pregnant teenager does require certain special supports, and a parenting teenager requires special supports. When we think about the foster care model, understandably, the focus is on addressing the foster care status. We need to try to get you out of foster care. We want to get you connected to a family or reunited to a family. So that ends up being the primary driver of the foster care system. But a kid who is pregnant or parenting has that issue, as well as the fact that they're in this developmental paradox. Teen and parent are really oxymoronic. They don't, everything that you need to be a parent is everything you're not as a teen. It's two different developmental frameworks, two different set of skills, two different sets of abilities. And our challenge then is to really bridge that developmental divide, because the risk is for that young person and that baby to fall through the cracks of that divide. So there's a lot at stake, so we need multiple models that pay attention to all of the outcomes that we want to see happen for that young person. First and foremost, we need models that help young women make the very difficult decisions about what they want to do about the pregnancy, and where we can leave our judgments and preferences and beliefs aside and help them to make this very difficult decision. Most of the young people we work with at Inwood House, they choose to keep their babies. And one of the things we understand is that the motivation for becoming a parent in the first place is often to have the family that they don't have. Okay, so there is a strong impetus in that regard. The other thing we can't forget is every young woman doesn't make the choice, that many young women are also victims of rape and sexual abuse and incest, and so it isn't a choice. So we can't assume that every young person, is setting out to do this. So they need help making the decision about what to do regarding the pregnancy. They need help if they decide they're going to continue with this. They need health care. They need prenatal health care. A lot of the services we will pay for later in the form of early intervention can be averted with proper prenatal care. So they need to be connected to adolescent-friendly prenatal care. They need help planning, lots of help planning in terms of where are they with their education? Are they disconnected from school? Our experience with young women at Inwood House is by the time they are pregnant, they've already been disconnected from school an average of 2 years. So it's not so much that the pregnancy disrupts school, they're already disconnected from school, and then they become pregnant. So getting them reconnected and back on an education plan is absolutely critical. Helping them prepare for employment, helping them prepare for the world, the wonderful world of parenting, and all that entails. And the models that we have tend to be focused on adult women, but they're not adult women yet. They're emerging adults, but they're not adult women yet. So we need services that are specific to where they are developmentally so that they can really benefit from them.
This has been a great planning process through the Department of Health and ACS and the city in being able to do the nurse-family partnership. And what it is as you mentioned, it's an evidence-based model, so there are criteria of the characteristics of people who the program works for. And there's other groups where if you're not willing to engage, you're not going to be able to get in. So we do need other models, and we're looking at other effective-based practices using other models, as well as NFP. So the NFP relies on nurses and folks who are very well-trained, and we're thinking of some modified version of that so that we can meet more of the need and also meet more of another population who doesn't meet the criteria for NFP, because you have to sign on to say that you'll do certain things. So I agree with you on that. The other piece that, just to mention with HHC, that I didn't mention with my talk, is that we have been working with the doctors there around early prevention of pregnancies, and we've been really strengthening the protocol on their discharge practices of teenagers who do give birth and what should be done after discharge. And so we have this pilot going on at HHC hospitals, and we'll be really excited to see how that works. And obviously with NFP, the results on multiple births after your first birth, it has an impact. So it does prevent pregnancy for later on. And that's a big deal too, because in the 80s and 90s, when we would see teenage pregnancies, the data indicated that if you had one, you were more likely to have 2 and 3. And so now if you have one, we've been able to, through NFP and other models, to stop to delay another child until you're in a situation where you're at adolescence, as somebody eloquently said.
So when you're talking about the protocols from HHC, are you saying that doctors should be making sure that, or the hospitals should be making sure that there's some kind of home visiting program or something set up?
There are some hospitals that are really terrific at reaching out and following up, and there is a protocol to follow up to make sure that the child is, the baby has natal care, and that there's a pediatrician involved, and that from early on you're getting the medical and social care from when you leave the hospital.
Right. So, Lorraine Stevens, with the Preparing Youth for Adulthood initiative, I mean, we talked about this before, the sort of a desire to move as many young people as possible into family situations. How is that working out for young parents or for pregnant and parenting teens who need a particular expertise in terms of a foster parent, right? I mean, what kind of work is ACS doing around that, and what are you looking for in helping the agencies find the right kind of foster parents?
I mean, I think that has definitely been a particular need in our system. Part of the work that we did last year was we worked with Columbia University on actually, and about 5 agencies, looking at what a foster parent would need or what special types of skills would be needed to actually be supportive of a pregnant or parenting teen, and what might that look like. And through that collaboration with Columbia University, we did develop a practice guide that will actually be distributed to our provider agencies on how to support foster parents. But I do have to say that piece around our expectations for foster parents and what foster parents need is key, right? Because it's not just finding a foster parent, but finding that right foster parent, but then also giving them the skill set and the support that they need in order to support a pregnant and parenting teen. And so part of the work with Columbia was about how do we identify that? You know, how do we work with foster parents on understanding that that is that young person's child, and how do you negotiate around how to parent and do some modeling for that. But also, how do you have that discussion around safety and risk for young people who may not be making good decisions about taking young people out at night and so forth, and having it not be punitive, but in a learning environment to help them grow. And so these are some of the challenges that we have. We are doing some targeted recruitment. We're working with some of our adoption recruitment agencies, You Gotta Believe in COAC, on actually doing some targeted recruitment for pregnant and parenting teens, and working with some of our mother and child programs on what that might look like. But also what skill set is needed, and do we need to modify our training, or do we have to have some different type of support for those particular foster parents?
Is there a concern that some foster parents want to do this because it's a chance to maybe adopt that baby, which is you know, a difficult situation, right? You want them to be the foster parent for the mom, not the kid, not the baby.
You know, I mean, I think that different people become foster parents for different reasons, right? But I do think, you know, foster parents, the conversation is about how can you be that grandmother to that child, to that adolescent, as well as be supportive to that baby.
Right.
And so we have seen adoptive situations come out of where they've adopted the teen and see themselves as a grandmother and a parent of both of the children. But these are the struggles that foster parents deal with, you know, every day.
Right. I want to get back to the issue of supports for families after a young person leaves foster care. There's a few examples of agencies that have come up with private money to be able to provide mentors or mediators, or just, you know, to be there available when a 20-year-old goes back living with their parent who they haven't lived with for many years. You inevitably conflicts arise. Some of the agencies, Children's Village, for example, has tried very hard to make sure there's always somebody who can go out late at night and talk with the parent, talk with the kid, and try and figure this out. And I keep saying kid. I guess I was a kid at 20. But is that something that can be systematized? I mean, it's certainly in the sort of lists of guidelines we talk about. It's in the recommendations for Child Welfare Watch that there have to be some kind of formal mechanism that requires the foster care agencies to provide this. But there's not money for it. You know, how is that something we need to be just making part of the contract, making part of the requirement, or is there some other way to do this?
I mean, I know that we're currently having discussions about the use of our preventive services and the availability for them to be available for children that are reuniting with their families. Just in terms of what the data is showing us, most of the kids that have a goal of APLA or young people are going back to their families of origin.
You want to translate what APWA is for people?
APLA is an alternative plan permanency living arrangement. I had to look at Jackie just to make sure I got it right. And which is independent living, the old independent living goal. And about 2 years ago, we actually looked at about 800 young people that left care with a goal of APLA and said, what happened to them? And of that number, about 3 of them were returning back to their families of origin. And the question became, what is the support, or what support did that family need? And were the safety concerns still the safety concern of when they came into care? Just in terms of looking at length of stay, we see that most of our young people now who are 18 to 21 have been in care 5 years or more. And so they've been away from their families for 5 years and now coming back. What does that mean for them? And so we are looking at what's happening on the preventive side, and is that an opportunity for support for young people that are returning home, if that's necessary in terms of preventive service to keep that family whole, to support that family as that young person may be transitioning back to them.
Right. Teresa, are we too quick to be talking about supports and services and all that, and we should be talking about how to just firm up the responsibility of young people themselves, to play the devil's advocate?
Well, I think that should be part of the discussion, absolutely. But I think, you know, as we were talking about developmental phases before, you know, an 18 to 21-year-old is even if when they're not a parent, we'll leave that part out for now, but that they're at a difficult developmental stage anyway. They're beginning to form their own identity. They're pushing away from the adult supports around them. And at that same time, we as a system are telling them, no, we want you to go to family, go live with family. And that's difficult for them. And as we were closing down our SILP apartments last year, we saw a lot of that struggle happening. You know, 19 and 20-year-olds telling us, I've lived with foster families when I was younger. I'm ready to be on my own, or I can't go back to a group home. And we had young people choose to sign themselves out of care against our advisement. We think that young people should stay in care as long as possible. You know, and so I think that you have to focus on their own independence because developmentally that's where they are, but you also have to continue to focus on that support network around them. I don't think it's an either or, it's definitely a both and.
And I want to point out 2 things that Teresa just mentioned. One is the end of the SILP program, Supported Independent Living Program, which we've reported on in this report and in some our work on our website, which is a somewhat controversial move by the city. Also, you mentioned that young people will leave often on their own just to try it and go there. And I guess supported independent living did give them a chance to experiment. There was apparently some issues. Some people have criticized it as a program that was a dumping ground for kids that didn't work out in families. What, you know, is there some, should we be thinking about some new version of SILP down the road in a different form, or is that just history? Teresa,
I hope it's not history. I thought that it worked really well for us, and I know, yeah, I agree, there's definitely some controversy about either how it was utilized or what it ended up being, and you know, there's a perfect picture in some cases, but it provided such a vital experimental living situation for young people, and that, you know, and in some cases for us, it helped young people realize, okay, I'm totally not ready for this. You know, I had one young person come to me and say, I'm not ready to be out on my own. I got way too lonely in the apartment. I needed other people around me. And so we placed her back in our group home. She did amazingly well. And now when she gets ready to leave, she'll have that memory and know how to create those situations so it's a different place for her. But in other cases, it was exactly what some of these young people needed. You know, a lot of them are very independent despite, you know, years of living, jumping around from home to home or family to family. And most of our SILP youth were in college, were working. I mean, it was really like a semi-college dorm experience for a lot of them. And developmentally, that was very appropriate. Obviously, the issues that came up with some of the ways that SILP was utilized needs to be revamped. So my hope would be that the future is maybe a different version of that, but that vital resource come back in some way.
And if I might just, because it also comes back to the same point that we were talking about, that Linda was talking about, Teresa was talking about, you're going to end up paying for it somewhere. Right. Because at least the SILP was an opportunity where you would have, and there were requirements. It's not just, you know, anybody could get into SILP. There were time limitations. You had to be in school or working. You had to be somewhat productive, because this was almost like your reward. When you're talking about an older adolescent in care, and at least this is my experience from my, you know, about 120 kids, and that's the other thing. I just have to say, because one of our clients actually said this, and it's something to take home with you, that the only parents he's ever known have been the system. Yeah. Because, and there are a lot of our clients who talk about it, if you want to talk about adoption. My caseload, and I work primarily with this population, you're talking about my clients, they've already been adopted and returned. They went home and family was just not a safe place for them. You have clients whose parents have been so inconsistent in and out of the shelter system that some of our clients have said, you know, I can't keep running around like this. But the only thing they don't want a replacement family, they don't want a replacement mom and dad, they understand that they need a permanent connection. That's fine. That could be that parent who they only have that one phone number for and you can't actually live with. That's fine. But what they want is a chance to do it on their own and to do it better than they had. And SILP was one of those opportunities to do that, because if you're not going to have aftercare, if you're not going to have a support system that can follow them after they do get their own, then you're going to have these exact same young people who, that's the data, that it bears it right out. Within 2 years, they're in the shelter system. You don't have that chance. Nobody's going to say, oh, you know what, you had a rough time. Like, that non-payment of rent for 2 months, yeah, we'll work it out. We'll work it. That's not how the world works. So the SILP was an opportunity for a young person to say, okay, I want my own. So I want this kind of couch, and I want this kind of cable plan, and I want this, this, and this. And to see, like, what it's like to pay your bills, what it's like to have neighbors who are going to, you know, call the landlord or knock on your door and say, like, quiet. But to have that kind of real life experience in a situation where, okay, so that 2 months of non-payment of rent, well, that doesn't mean that you're out on the street with everybody else. That means you're back in the group home. That means we're going to set you up with a dying program, the Youth Financial Empowerment Program. You know, there are, I mean, and they're out there. The programs are out there. It's just a matter of, first off, getting all of the agencies, because I can tell you from the perspective of an attorney who works with different agencies, I can tell you off the top of my head which ones I love to hear my clients are with and which ones I look at and go, okay, I'm just going to keep this file on my desk because it's not going to go anywhere. Right. If we can be more uniform about that, and if we do give opportunities like SILP, even if you want to make the requirements more stringent, that's fine, but at least they have the opportunity, because then you also have them focused. Because if you don't have something like that, that they can feel like, I did the group home, I did the foster home, I lived through somebody else's, you know, rules and regulations, and now I get the chance to do my own. By the time they're 18, they're like, I didn't get anything out of this. I just had a roof over my head that I didn't really like, so see ya. And you've already lost that young person. You've already lost the opportunity to say, like, okay, great, I think you've been doing really great stuff. You're going to graduate from high school. We're really, really proud of you. Try this out, and let's see how that works. And because then, after that, you get your own job, and we'll fill out those applications for you. And it sets them up in such a more empowered way, because they have something that they can point to, not just, we found this family for you, and you're going to go there, and you guys just work it out.
Well, yeah, and the other point that Teresa made a minute ago, which I don't want to gloss over, is this notion of, she sort of offhand said, we want them to stay in care as long as possible, which contradicts much of, you know, the attention to trying to reduce lengths of stay. But There is actually pretty solid research from the Midwest study of this population that shows kids who stay in care, once they get to 18, if they stay in the system to 21, they're much more likely to have a smooth sailing after that.
Although
than if
the
they
rates
leave at
weren't
18.
so great. I was
Exactly.
disillusioned very much with that study,
Really?
in fact, yeah, because they stayed, and it really was an indictment on the system. They stayed longer thinking that they would have better outcomes. And in fact, the outcomes staying longer weren't that much better, which really raises the question of what do you do when the kids are in care, and where do we put our emphasis? And that's, so I think in speaking on behalf of ACS and the issue of families, that it is important for a kid to have someone that they can rely on and to develop that relationship during adolescence, because that is a part of adolescence too, bearing your parents, bearing an adult. And that is a developmental milestone when you're able to have that kind of relationship.
When you can
Right, and I
tolerate
think-
your parents.
Well, from a young person's
Finally grew up.
perspective, that's right.
And I kind of wanted to chime in a little bit about the SILs, because I do want to say that that was a difficult decision that was made. And I think we all have to be conscious and aware of the resources that are available. And I do want to, I agree with Teresa, and I agree with Pretty that the SILPs had a special place for some adolescents. But I also want to put the alternative side, that if we're utilizing resources for a model and it only helped this number of young people, what happened to all of the other young people that did not get that support or did not get that? And how do we use those resources to integrate it in a model? We have caseworkers out there with extremely high caseloads, and we have a lot of adolescents currently who are in foster homes, who need the support of foster parents and caseworkers and law guardians and everyone to come together and having the same conversation about how do we use the resources we have to make sure that your plan, your individual plan, is the right plan to help you transition to whether it's by yourself in that apartment, and what do you need, and how do we build those skills in that foster home? How do we build those skills, you know, in maybe in a group setting, in a residential? But the conversation can't happen in silos.
Right.
And we can't think that one size fits all and leave this conversation that thinking that every 18 to 21-year-old needs that SILP model, but they do need someone that's going to support them, that's going to teach them all of those life lessons that some of us learned in homes and some of us learned from friends or relatives or just maybe that social worker or someone else. But how do we learn those life lessons, but then have that support when I go maybe into a supportive housing or that NYCHA apartment by myself and I can't pay my rent, that there is someone I'm connected to that I can reach out to and say, hey, I need a little bit more assistance. And I think the conversation in this environment today where the resources are getting smaller and smaller, I think we have to look at child welfare as a whole. How are we supporting our provider agencies? Do the caseworkers have everything they need? Because that's the person that young person is talking to every day. And if they have a caseload of 2025, then that conversation will not be the same as it might be in a smaller setting, right? And so I think these are some of the issues that we grapple with, but it's,
Right.
you know, it's also about where do we put our resources, where's the focus, and then how do we all together speak the same language to the young person to help move them in the right direction.
So we're going to start taking questions in just a minute. So Anna and Karen, I guess, are going to have mics, and if you raise your hand now, they'll come around to you while we keep talking here. Anna, are you going to do one of the mics? Or? Okay. Are we focused too much on young people leaving foster care and going into their own apartment? Is there some middle ground that we should be more structurally built into this system, or is it already? I mean, I certainly didn't have my own apartment for many years.
If I was going to say, that's the one thing, and Lorraine knows this because we've had this conversation before, roommates. Because the one thing, when all of the priorities and everything started to be established with the NYCHA priority, with the Section 8 voucher priority for however long that lasted, the one piece that was missing was, what if this was a young person who needed someone else? Like, if there were two close friends and they wanted to move in together, so how would that look, how would that work, and how could the system support that? And I still don't think we've found the answer. we're still working on that. I know Lawyers for Children, we actually, just yesterday, we're actually starting a housing bulletin board to see if our clients can connect with each other, and maybe that could be the safe place for them to work things out. But that's absolutely part of it, too, is that you're, and I can hold this up, I mean, and God bless our housing specialist, she made this, but like, this is what housing comes down to in New York City, like a bunch of boxes and a bunch of requirements. Like, that's not realistic.
Right.
This is handy, and it's great that I can sit down with my client and kind of go through it and feel it out, but when you're talking about taking services, taking preventive services, taking SILP away, you're taking away options on what that could look like, because SILP apartments were also, some of them were solo, some of them were roommates. You're navigating other people to see if this could work out. And not having a system where they can do that, be supportive, make those connections, and know really who they're dealing with, and have someone saying, like, no, this is an okay person, you're an okay person, it'll be okay.
Right.
Because it's scary. You're looking out there, you don't know what you're looking at, you don't know who you're meeting, you don't know any of that.
Right.
So you've got a young person who already doesn't have that strong connection. It's like sending them out into the wilderness. Like, my story when I started was my supervisor came and found me and she said, I need your help. I said, why? She said, 2 of my clients are turning 21 and the agency wants to give them 2 Metro cards and waive. Like, yeah, let's work on that.
Nice.
I'm hoping that's not the option that's left, because there's no Section 8. New York 3, there's a waiting list now for that. NYCHA, there's a tremendous waiting list, and again, this goes back to why I say planning, because you need to let a 14-year-old know you need to get a part-time job at some point, because income is income is income, and that's a requirement if you want to pay for a roof over your own head. They don't realize that until it's later, and then at that point, everything has kind of just gone somewhere out of their control. If you can get all of that together, if you can give them a safe space to find those alternative housing plans, they're out there. It's not that they don't exist. Right. It's a matter of connections.
Right. Okay. Question over here. Please identify yourself.
My name is Lawrence Washington. I worked with the ACS video unit for a lot of years, and one thing that stuck with me in an interview with a teen was that she had all of those things as far as an apartment, she had a savings, she had all of the things that was provided, and she fought for those things also. But she said once she got it and she was alone, like that's the one thing she had to deal with, being alone. And I just wonder what's in place for them, to deal with those feelings of being alone, and kind of like, once they have all of the things that's provided, once they're alone and get to sit with that feeling, what's in place for them?
I think that's an awesome example of a lot of the reality for young people, and that, after we've talked a little bit about aftercare, obviously there's not enough resource around aftercare, but that it's up to agencies sometimes, I think, to find ways to meet those needs as much as possible. We do a lot with our young people when they leave, even if they're moving into New York 3 and they've got, a caseworker there or supports or whatever, that we do a lot of that personal touch around, helping them decorate their apartment, or going to visit them within a couple weeks and making sure they have things they need, and maintaining those connections, even though that's not part of the expectation or funding necessarily. So there's a lot of personal responsibility, I think, for agencies around that. And if we can talk about resources, wherever that magical pot of money is, that I think that's one area that we need to look a little bit more at. Housing is one thing, but how do you maintain the emotional stability of early adulthood is a big problem.
Some of the conversations that we've been having with our community partnership initiatives, for those of you that don't know, we've partnered with 11 communities throughout New York City that do family team conferencing, that do recruitment for foster parents. They're also looking at family visiting. But now we've opened up the conversation to talk about our young people that are leaving the system and transitioning to themselves and going into apartments or going into New York 3. And how can the community partnerships actually be a resource or a mechanism when they can come to have someone to talk about that understands a little bit about their experience and be able to be supportive. We've also reached out to the faith-based community. We're currently partnering with 10 churches right now. And the discussion with these churches and New York Theological Seminary is about young people coming back into communities and not having that support. and what can it look like, or what can the churches or the youth ministries in those churches do to support some of our young people that are coming back into those communities. So we're opening up the dialogue to say, yes, the child welfare community is doing ABC or not doing ABC, but what can the community do? What can the community wrap around young people that are coming back into your community that are feeling very isolated and feeling very alone? And so how can they be supportive of some of these young people?
That's great. Hi, my name is Evans. I am a student here at Milano. My question is for Marianne Schretzman. I've worked as a case manager in shelters, and more recently with the Learning to Work program in the Bronx. And my experience working with a lot of the youth was that it was difficult to coordinate like the basic services of the different city agencies. And I have also had the same experience in California. So my question to you is, what can ACS do to create cohesion or coordinate the different like planning and policy among the different divisions in agencies that provide services to youth coming out of foster care?
I think we have a beginning. Do you want to?
No.
We have a beginning process going on right now with ACS, DOE, DHS at the table on a biweekly basis to figure out how we can coordinate better. And I think even with these programs that you're describing, it's been a coordination process to make sure that these young people get into those programs as well, that those schools actually are very helpful to some of the kids. And how do they get dibs on those programs? Because there's a limit of the resource. So part of it has been that we've been meeting to come up with a planning process so that we can make life a little easier. For example, with HRA, with most of those young people now, we have had an expedited process so that they can receive public assistance, and that is coordinated with MetroCards, with DOE. So it's, I believe, an ongoing process. And if there's something specific that you have experienced or that you think is systemic, I'm glad to hear it, and I'll speak with you after if there's something that we're missing in our meetings as to how to address that.
I just want to add, Marianne, there's been a lot of coordination on the housing front with DHS, with NYCHA, with ACS in terms of trying to streamline the process as much as possible for our young people, and start to actually this year we developed a training program not just about how to fill out the housing application, but what happens when you go down to NYCHA, and what do you need, and what is the conversation you should be having in order to make sure that you're eligible for NYCHA. There's also been a great deal of conversation with HRA around transition Medicaid, ensuring that young people do not leave foster care without having the medical coverage that they need, and coordinating a response to ensure that that's in place before they leave care.
Yep.
Hi, my name is Brenda Zube. I'm a social worker at the Bronx Defenders. We work with parents who are going through the system. And one of the questions I have is just if there's any research or information about the mental health effects and consequences of growing up in the system. And I know a lot of what we've been talking about is like the young person being able to have one person they can count on. And I think, obviously there's a lot of issues with rejection, like from being put in foster care in the first place, but constantly being in contact and having to rely on people who are also mandated reporters or who are divulging all your information to court. And I know there's a part where we encourage young people to take responsibility for themselves, but I also wonder, like, what information or research is being done to see what responsibility the foster care agencies or workers have in kind of actually like functioning a certain amount of dysfunctionality with foster youth, and I'm kind of curious about that. I don't know if anyone has anything to say.
Daniel?
Well, most of the youth that I work with, they do have several issues with, mental health or those kind of things. And it's hard to work with them because we, have limited resources to refer them to. They already have a distrust with everybody. It's even hard for them to first open up to us as nurses. So we try to really establish trust in our relationships and eventually they do disclose information that would blow anybody's minds. It's, you know, it's incredible what they're walking around with on a daily basis, and then to compound that with pregnancy and, you know, being a parent. So hopefully, you know, we have our own mental health clinician on hand who does help us with issues that we may not be prepared as nurses to deal with. But the resources externally are really, really limited, and we are struggling to find, you know, resources that we can refer them to for the complex mental health issues that they do have. I don't know if anybody else has.
Teresa?
Yeah, I would, in terms of rejection, I just want to say a couple words about LGBTQ youth, because I think it's a perfect example of a population that experienced multiple levels of rejection. And in terms of research, I highly recommend everyone's homework here is to look up Caitlin Ryan and the Family Acceptance Project in California. They've come out with some really, really excellent statistics and proof that acceptance by family and support by family leads to reducing a number of health risks around depression, around suicidality specifically, but other things like substance use and you know, general health issues. So I think, I mean, obviously, you have to be careful how you generalize research, but I think we can safely say that it could be the same for non-LGBTQ youth as well. Youth that are in the foster care system are perfect examples of young people who experience high levels of rejection.
I want to point out that we have a piece on our website. We have a few websites affiliated with the center. One of our main sites is centernyc.org, but we have a project called Feet in Two Worlds, which is produced by journalists from immigrant communities. And we put up a piece yesterday about two young men, gay young men, and their experience of not only complete rejection by their family, but complete rejection by their communities, and sort of what that's meant to them and where that's left them. So it's worth checking out. That's news.feetintwoworlds.org. Over here, yeah.
Hi, my name is Rachel Marquez. I'm a student at Milano, and I used to do a lot of work around youth engagement in Vancouver, both with mainstream and higher risk populations, including street-involved youth. And I've been really interested for the last several years in the role of youth engagement in the decision-making process. And I'm wondering if any of you could speak to both the role that young people either in the system or coming out of the system had in developing the recommendations. I know they were involved there. And also Andrew mentioned the role of peer advocates and the importance of that. If anyone could speak to how that, sort of what the policy implications are there. In my experience, the more control youth have over some of that decision-making, the more successful they're often going to be. Thanks. Thanks for your work.
So I should probably talk a little bit about the implementation of family team conferencing in the child welfare community. And so back in 2009, one of the things that we did was our Improved Outcomes for Children initiative. And a key component of that was actually having family team conferences using the Annie E. Casey model, 6-stage model. And you guys can look that up. But what was key about that model was that the young person should be at the table, as well as their family, if there's a family, in making those decisions. And so one of the things that we started to implement system-wide is that every time we have a service plan review, we should be having a family team conference, and the young person should be at the table in those decision-making. Anytime a young person needed to move, if this foster home, if there was conflict in the foster home, we needed to come together at the table, and that young person needed to be involved in that decision-making process. Teresa talked a little bit about the reduction in residential care and closing the SILPs. Before we moved any young person out of a SILP, we sat down at the table and said, this is a decision we made, but let's talk about what your plan is, and you need to be a part of the decision on what's the next step for you. And so that's really been key in our work in terms of youth engagement and including young people in the decision. We also have a small unit at ACS through grant-funded money of youth advocates that have actually been participants at many of the residential care conferences. And part of their role is to kind of help the young person understand what is happening, hear that youth voice about this is what's going to happen, this is what's happening at the conference, this is what they may ask of you, and helping them to understand some of the language that we as social workers might be using and not youth-friendly language. And so that's been extremely productive. We are branching out. We've gotten some money to actually do and for agencies to hire youth advocates to do their family team conferencing. I do want to say one of the things that we have found in implementing young people or youth advocates at family team conferences is that we did not necessarily see a model throughout the country. And so Annie E. Casey is helping us to kind of develop that model and what that might look like, because we know that in using peer advocates, they also come with their baggage and their trauma in foster care. And we want to make sure that they're, you know, working with the other young people and helping them to make good decisions.
I should point out another key part of that is parent advocates working these young people. So peer advocates and parent advocates who can bring a very different perspective to the table from the people working in the system. Over here, yeah.
Hi, my name is Maria Baldridge. I'm an attorney for young people and kids out in Queens Family Court with the Legal Aid Society. Most of my clients now, because I work with the adolescent practice team, are this population, 17 to 21. Hi, pretty. A disturbing trend that I'm finding, because what we're talking about here, an overall theme, is that these kids, these young people, over time have less and less of a safety net. And what I'm finding is that while my clients, a lot of them, you know, we have a very, you know, small practice, so we're able to make sure each of them, you know, if they're able to get an apartment, if they have children, they get hooked up with the Nurse Family Partnership. Actually, Taisha was my client, and actually Cherry Gibson on the front of there is my current client. And I'm sad that Taisha's not here today. But something I'm noticing is that a lot of the foster care agencies, and I don't know if this is budget-based, et cetera, is they're encouraging young people who have been on trial discharge for a while to agree to a final discharge prior to their 21st birthday. And it's something I'm hoping that ACS is not instructing the foster care agencies to do, and I'm hoping that this is just something that hopefully I'm bringing to light. But I don't know if this is something that is due to budget cuts, et cetera, but I don't know if anyone has any information about that. I'm sure Ms. Stevens is not pleased to hear me saying this. But it's just a question that I've been noticing, and I know that, like, Taisha was, for example, in her own apartment fairly early. She was determined at the age of 18 to have an apartment. We kind of got her into the SILP. We were very excited about that. But a lot of my clients, like Cherry, is not yet 21, and she hasn't had that experience, but a few of them have, and I think it's something that is a little bit disturbing.
Can I just comment before you? We're finding a lot of discrepancies between various implementing agencies. It's not that there isn't a policy in place, but they're just doing their own thing. And I think on a monthly basis, our director is meeting with ACS to discuss some of these discrepancies, because it's, you know, there's no consistency, you know, between individual agencies, and that is a very big problem.
Lorraine, how do you I mean, this is about enforcement of the rules, right?
So I'm not necessarily sure how to answer that trial discharge question, so we probably need to look at that. I do want to say that each young person should have an individualized plan. So for an 18-year-old that's going into an apartment, a 2-year trial discharge may not be appropriate for that young person, right? But for another young person who's 20, who may have a job, who may have support systems, may have someone else going into apartment, may not need a trial discharge, period. And so I think that's part of the discussion around one size doesn't necessarily fit all. And I think that's what the agencies struggle with every day in terms of figuring out what is the right plan for this particular young people. And on top of that, the challenges in terms of how to actually plan. I do want to say, probably for that particular scenario, what I said earlier about us all speaking the same language and understanding, whether they're involved in nurse-family partnership, whether they're at an OMH clinic, whether they're talking to their legal aid attorney, are we all speaking the same language, and are we all clear about what the plan is? Because I think a lot of it, what we feel is happening in the provider community is sometimes a miscommunication in how we share information, and also how do we all plan together with the young person on moving them to their right plan. I do want to say there is also an accountability mechanism. We are putting together a small unit that is going to start to look at are we planning earlier upfront for housing? And having those discussions with the agencies about what is happening and how is the discussion happening, but also how can we help you in having those discussions, and where are the gaps, and what trainings, what supports, how can we support those caseworkers out there who are working with the young people every day? How can we share information with the children's attorneys about what's happening with them in terms of employment, housing, medical coverage? And so there is an accountability piece. We have to hold ourselves accountable to make sure, but we also have to make sure that our agencies have the resources and tools that they need. And then we also have to make sure that we're all speaking the same language and sitting down at the table together to make sure that we're all moving in the right direction for what's right for that young person and working together.
So speaking of resources, I want to point out a few things that are important news, you know, without playing the part of advocate here, or maybe I will. Even Nurse-Family Partnership faces a potential for some kind of a budget hit this year. In the state, Andrew Cuomo's budget proposal, there's a pretty much 2/3 reduction in sort of alternative preventive services funding, pushing it into a block grant that would have serious impact on home visiting programs and other things. There are the cuts to children's services that have been ongoing now and going into their 3rd year that clearly have an impact on all of these services. And there are other things that are slipping my mind right now, but it behooves you to pay attention to the news coming out of a number of both advocacy organizations and ourselves. We're trying to keep people updated on what the status is of these budget debates. It's not looking very good, particularly at the state level this spring. We have time for one more question. Larry.
Larry Murray. I'm a member of the Watch Advisory Board, and I work at the National Center on Addiction and Substance Abuse. So I want to talk about substance abuse. And I also want to make a comment. With the exception of Andrew, there's a distinct lack of a male voice on this panel.
I noticed.
And it sort of has led, to me, my opinion, to a lack of a sense of what's happening to the boys and young men in the system. Are there distinctions between their experiences within and upon transitioning out from the young women who are transitioning out? And how are those distinctions being addressed if they exist? But on the question of substance abuse, it's a big predicate for failure in a lot of different areas, including homelessness and lack of school completion and not finding a job. And so when it's noticed, when it's identified with kids in care, what happens? And how long does that thing that happens occur?
Teresa.
Wow. Yes, substance use is a huge, huge problem. It is this ongoing struggle, and we have tried, internally in our programs to look at all kinds of different options. Do we focus on having a substance abuse counselor on site? Do we partner with other agencies? Do we focus on disciplinary measures if they're coming in late and high all the time? And so there's a lot of different ways that we've tried to look at this issue. We're actually currently hiring a psychologist with a specialization in this area because we feel like we need someone on site constantly to be able to address these issues. It needs to be integrated as part of our program approach, not a separate entity. And in every single one of the interviews that I've conducted here, that's what I've tried to explain. I want it to be part of positive youth development. I want it to be part of FTCs. I want it to be part of supporting LGBT youth and their identity development. There are too many reasons why young people will turn to substance use, right, for coping, just for dealing with daily life, much less the traumas that they've been through. So I think a lot more of us need to challenge that internally around how do we address that. There's not a quick fix solution, obviously, but we need to continually consider that issue. And in terms of the other part of your question around males in the system, I can speak about gay boys because that's what I work with, but obviously there are a lot of difficulties with aging out for gay and bisexual young men in the system, and that much more for, I think, for transgender women who were previously male identified. That's a very, very small niche of the group that you're talking about, but a difficult issue. And I think that finding LGBT-affirming family homes for them is something that ACS is putting a lot of energy toward, and obviously an area of development that's much more needed, but that most of the time we end up having difficulty with that kind of placement, and they age out into their own independence when possible.
All right.
Just say
Yeah,
something
Linda.
about young dads. We at Inwood House have a Father's Count program where we really try to engage the young fathers who are partners to the girls. They are often very strongly motivated to try to participate, to try to be part of their young family's life. But the experience they have from most corners is you're not welcome, you're not wanted, you know, bring the diapers, bring some money, and then go away. And there really needs to be a focus on respecting that family unit and recognizing that the father has an important role to play. And research shows that the young dad's involvement in the young mother's life is good for the young mother, it's good for the child, even if they're no longer a couple. But they also need a lot of support often when they're no longer a couple, which is not atypical for young people that age, to deal with issues around co-parenting. So part of the service we also help to provide is co-parenting counseling, so they can kind of navigate some of the thorny issues. You're seeing someone else, I don't like him, you know, but I'm coming to visit the baby, and just dealing with some of those issues.
Right. Great. A couple of things I want to say to tie this up. One is, you know, we sort of filtered, scattered throughout all this were a number of concrete things that need to be followed up on. We didn't really have time to bring it all down to ground and say what's next. The center itself on our core website does not have a good function at this point for comments and conversation, though we're hoping to work towards that. But we do have emails, all of us who work on this project, so please, you know, if you have ideas coming out of this, send them our way. I'm at whitea@newschool.edu. I want to thank Abigail Kramer and Kendra Hurley for their remarkable writing on this report, and Karen Mirowitz and Anna Schneider and Mira Orrick for helping coordinate the event itself. And I very much want to thank this panel. This was excellent.